locked one of these things up. But what makes this different? Well, certainly the not-for-profit status of this makes this different. And some of the other issues that will generate. If we do generate, or well, say when we do generate profits or surpluses, whichever we want to look at that financially, those have to go back into either quality programs or reduction or stabilization of premium. So one of the goals of the co-ops nationally, and one of the goals of the entire reform process is to start a process that you can have change with. This is, Jason said, this isn't happening today, and I agree with you that it's going to get more complicated over the next couple of years than it is today before I think it's going to start to change. And I think change is probably more on the level of 10 to 20 years kind of time frame, because this thing didn't happen to where we are today. This started, I'm guessing, in the 60s with Medicare. I mean, it was a different world. That has happened. The cost of health care, as you look at it, has been increasing quite a bit. So where we see this is a value calculation and value for consumers. That's what we're going to really be putting forward. Everybody has their own vision of what a value what value in healthcare is. I have a mathematical equation I can throw out. Anybody can challenge. That's fine. But I think value is quality divided by cost. And everybody has their own internal calculator of that. If you look at value of the entire healthcare system in the United States, everybody knows that we have, how many times higher than the next twice as much, we spend twice as much without the quality indicators that would support that. I mean, you've all heard the numbers. So that's one way to look at value. Consumers look at value in their own way. For-profit payers look at value in their way. If you purchase a stock, whether it be in healthcare or anywhere else, I would imagine that the number one thing you want in their mission statement would be return on investment. That would be why you invest. So a for-profit carrier's motivation as one of their mission statements will be shareholder, stockholder value. What we look at as what the co-op's mission is as a not-for-profit is consumer value. So we look at that much differently. So we look at consumer value being affordability, access to primary care, quality initiatives, all the rest. So our calculation is a little bit different. Let me see if any of these slides are saying anything. So. Not really. I'm in the Q&A already. That's good. I tried to keep them short. So the board of directors, has this mission that we have. You can look at our website, look at our mission statement. It is about the development and continued development. Now, the IPA has been behind this for a long time. The entity that I am running now is truly behind the patient-physician relationship. We truly believe that if that is done properly, physicians and their relationships with their patients, provided with education, and consumers need to get engaged in this process. That's why this is not a quarterly issue, not an annual issue. This is life-changing, cultural, sounds theoretical, but it has been and done in other parts of the country, and it has been done in other countries. That primary care physician, or that physician relationship, not just primary care, with that patient can drive a stability in costs. And we have seen it. There are plenty of examples of this around the country. So one practical way of doing that is to help spawn patient-centered medical homes. Part of the loan that we received from the federal government, we reinvested back into the community by providing consulting services for an additional 75 practices around the state